epidemic risk warnings from two sources. Epidemic risk warnings from two sources are a timely reminder of an ever-present risk. Our recently enabled feed on Epidemic has highlighted two articles of interest. The articles are from Big Pond News and are titled US Flu Reaches Epidemic Levels and Notorious Bug Could Cause Epidemic. The first article highlights that a flu outbreak in the US has reached epidemic levels and it will be at least several weeks before the outbreak abates, health officials say. Flu, or pneumonia, were responsible for 7.3% of the deaths reported in 122 cities monitored by the Centres for Disease Control and Prevention for the week ending January 5. That's just above the epidemic threshold of 7.2%. Whilst the second article refers to a totally separate bug known as the Sydney 2012. It is a norovirus variant and was identified last March by the University of New South Wales and the Prince of Wales Hospital in Sydney. The virus has become the dominant strain in the UK, infecting about 1.2 million Britons and resulting in dozens of hospital ward closures. It's also been detected in the United States, New Zealand, Europe and Japan, and is suspected to be behind the recent gastroenteritis outbreaks aboard several cruise ships. The virus is likely to hit child and aged care facilities and hospitals hardest, and could result in ward closures. Although neither of these viruses are raising significant alarm bells in the scientific communities, it is a timely reminder of the ever-present pandemic risk for all organisations. Organisations across the globe, regardless of their size and or location, need to consider pandemic risk and ensure they develop and test a pandemic preparedness plan. The World Health Organization provides some excellent guidance on the creation of a pandemic preparedness plan. In particular, the World Health Organization checklist for influenza pandemic preparedness planning. Pandemic preparedness plans are a key component of an effective business continuity and crisis management framework for organisations. Yet, many organisations consider the pandemic preparedness plan a secondary thought, or even worse, a document for document's sake. Of course, in the event of a real pandemic, that sentiment will rapidly change. So it is in times like this that as risk managers we should actively promote this key process and document to our business leaders and executives. Whenever we see two separate events occurring like this, it raises the early warning signs for us on managing our pandemic risks and ensuring we are prepared to help our customers and employees in the event of a serious pandemic event.